Welcome to The Scoop from the Lurie Cancer Center's Adolescent and Young Adult, or AYA Cancer Program. We bring together AYA cancer survivors and experts to answer important AYA cancer-related questions. We hope you enjoy the conversation today. Hello, everyone. Welcome to The Scoop. Thank you so much for being here with us today. Today, we are going to be talking all about how to navigate a new cancer diagnosis. So we'll start with introductions. I am Bryn Fowler. I'm the Adolescent and Young Adult Program Coordinator at both Northwestern Medicine and Lurie Children's Hospital. And here with me today, we have Jennifer Carrera. Jennifer, do you want to introduce yourself?
Hi, everyone. I'm the Adolescent and Young Adult Oncology Navigator at both Northwestern and Lurie Comprehensive Cancer Center and Lurie Children's.
Awesome. So Jennifer and I work closely together every day, so it's fun to be here in this setting together talking about her expertise and how to help patients through navigating an initial diagnosis. So can we start by you telling us a little bit about yourself, your role, and how you got involved with this work?
Sure. For the purposes of this talk, I'm going to say the words AYA instead of Adolescent and Young Adult Oncology. So my role is to provide navigation services and programming services to patients who are diagnosed between the ages of 15 and 39. My services vary depending on the patient. I can provide emotional support, education. I can provide supportive counseling for patients and families. Resources specific to AYAs, as well as structured therapy. I also co-facilitate 3 support groups specific to AYAs. One is for patients 18 through 39. One is for patients plus a guest. And one is for AYA caregivers only. I came out of the womb as a social worker. I'm always fighting for social injustices at the dinner table and volunteering at a very young age. Also getting involved in philanthropy at a young age and politics, which led me to becoming a social worker in geriatrics. That was my first passion because I was very close to my grandmother. And then an opportunity came my way. I don't know if it was divine intervention, but it was for an oncology social work position. And I myself am a young adult cancer survivor, so I was a little cautious to take that position, but I'm glad I was open to it because that now has turned into my second passion in life. I started in about 2009 with my passion on championing young adult survivors and that movement, which led me to this position here.
That's so great. I love how everything comes together for your current role, and we're lucky to have you. So if you think about the first time you meet with an AYA and maybe some of their family members, what are the things that you typically cover that first time that you're meeting with them when they're probably feeling overwhelmed and worried about what's coming next?
Yes, that seems like an easy question, but it really is very difficult because every AYA, every patient and family are so different and everybody copes very differently. So my first goal is to see where they're at. What is their understanding of what they've been told? What are they even calling it? Some people even hesitate to use the word cancer. So I have to find out emotionally where they're at first. Some people are in shock. Some people are sad, anxious. Some people are in hyper-focus mode where they want all the information and resources necessary. I will help anybody in any stage, and it may take several sessions to even educate or provide resources because they're just not there yet. My main goal, though, in that first session is to alleviate distress and establish rapport so that they know they can always come back to me. Another goal is to help them at least learn a little bit, even if they don't want to know the details about what to expect. I want them to know the basics of how they can do well with treatment. I want them to do well with treatment. I always ask if they can bring their primary caregiver for our first session. I may not have the primary caregiver sit in when I elicit their history, but I may bring the family in when we talk about education and resources so that that patient has a second set of ears to be able to retain that information. When they're in fight or flight, which is what happens when you're first diagnosed, you perceive a threat, you can tend to not absorb all the information that I'm providing. So it's really helpful for the patients and the families. some of those resources that so then I do assess what their needs are, and we talk about the immediate concerns first. That's always my goal. So that might be childcare. That might be, I'm in school. What do I do? That might be, what do I tell my boss? And so we talk about the immediate concerns, and I develop a plan for them just for those immediate concerns. And we address that. So that might be the Cancer and Careers website to help them on how they disclose their diagnosis to their employer, or how to go about finding childcare, or how about telling their child that they have cancer, or their niece or their little sibling. So I give them resources for that. And then I do attach a full resource packet that they can look at their leisure. But I usually follow up in a week or two to see how are they doing with those immediate concerns. Were they able to address them? And if not, we'll go over everything again because it's okay. It's normal to forget. I do follow patients for therapy as well. So that might start right in the beginning, or that might be down the road. We develop a plan for introducing skills that will help them through the journey of cancer. Some patients I check in with just for intervals for supportive counseling or resources periodically. I advise them in the beginning to think about it in 3 drawers. So in the top drawer, I say, put your very most immediate concerns. What do you have to address now? Do you have to inform your school? Do you have to tell your partner? Let's do those right now. Then in the second drawer, put those needs that you can address in a couple of weeks. And you and I can meet again and we can talk about those needs and pull those out and see how we're going to address them. An example of that would be maybe the hospital bills. They're probably not going to have to address them right away, but that might be a concern of theirs. And we can talk about troubleshooting and strategies and resources to help pay that hospital bill. And then the third drawer is for things that they have no control over. Put those things that you have no control over, visualize putting them in that drawer and shutting them. And you can take them out after treatment is over, or when you feel comfortable in addressing those. Because right now it's just too overwhelming to tackle all of that at the same time.
Yeah. That's such a helpful visualization. And some of those visualizations can be so powerful, like you said, and just literally putting that out of your brain as much as you can until you have the capacity. I really like that. So do you have suggestions for an AYA who's newly diagnosed for how to take care of their own mental health while they're navigating so many of those other concerns, whether it be the financial pieces or anything else? How do they take care of their own mental health?
Yes. Well, first understand it's normal to be shocked, sad, angry, anxious, all of the above. So in light of that, I say reach out to an oncology psychosocial expert. That could be an oncology social worker. That could be a psychologist. That could be an oncology chaplain. Somebody who has expertise in emotional support and guidance for patients who are coping with cancer. Cancer's hard enough. Let us make it easier on you. And you may need us for a few sessions to recalibrate, or you might need us longer term. But either way, okay. A new diagnosis affects the entire family. So I also encourage caregivers to get help, because if the caregiver is tending to their needs, that's going to indirectly help the patient as well. I also tell families to meet as a family, which is, some people are quite taken aback by that, because I do see a lot of, let's say, parents talking amongst themselves or siblings, but not families talking together about the cancer. I tell them to picture, if this were a storm, if this were a tornado and it was coming at you at your house, what would you do as a family? You would come together, you would huddle, you would talk about the strategy, you would talk about the plan, you'd want to protect each other, and you'd communicate. And you'd communicate every once in a while, how's everybody doing? A lot of people want to protect their loved ones by not communicating, but that leads to isolation and assumptions. And so every once in a while, it's good to have a family meeting. And we offer help with that as well. I can help mediate those family meetings and offer support. There's multiple ways to maintain your health, mental health, when you're going through this, utilizing one's faith, integrative methods such as massage, mindfulness, counseling, and then support groups. Support groups can help AYAs feel less isolated and normalize their feelings. As I said, sometimes a few sessions are all one needs to sort of recalibrate and continue on and adjust. But some people might need longer term mental health support. And possibly medication. So if somebody enters into cancer with a pre-cancer history of a mental health issue, I immediately tell them to let your mental health provider know, because that will increase your stress and likely to exacerbate your symptoms. And so if you don't have a mental health provider, we can help you find a mental health provider either in the cancer center or in the community. And then it's also overlooked that people can struggle with anxiety and depression after cancer treatment is over. So I do educate folks that you might experience some anxiety after treatment, because a lot of times they may not speak up and they'll feel isolated in those feelings. So I'll tell them it's okay to not feel happy when you're told you're in remission. Often patients tell me they feel totally alone. Everyone around them is happy, and why am I not feeling happy? It could be a lot of reasons. One is they're fearing recurrence. One is the cessation of that care that they've had surrounding them and the active treatment that was killing their cancer. And less contact with their medical providers, which was a comfort and a support. So I tell them this is a good time to reach out for counseling or one-to-one peer connection or a support group that can help you feel less isolated. They can also feel confused about their identity and how they can proceed forward and what does this mean. They can also feel pressure to be this super cancer person where they're going to start a non-for-profit or do some amazing things. So many feelings, and it helps to have somebody to help them sort it out. They also can be coping with losses. Some people can experience infertility or cognitive deficits or changes in body image. And so it can be really hard to reintegrate into their new life given these losses. They need to grieve and readjust. Post-treatment is when I often see patients in my young adult support group, because their brains and their hearts are now catching up with the experience that they went through. And they really do want to process and find others who are experiencing the same situation.
Yeah. A lot of really good information in there. And I think really underscores the value of someone like you and, accepting help from other people to help you realize some of those ways that you can take care of your own mental health and that of make sure your family members are taken care of as well. This, you talked a little bit about this in your drawer illustration. Can you talk a little bit more about maybe what parts of this are a marathon, what parts might feel more like a race?
Yes. So in the beginning, when a patient is diagnosed, it can feel like a race, but a race where you have to hurry up and wait, which can be really upsetting and induce anxiety. A diagnosis might be suspected, but they're still getting through all the necessary tests and procedures before even starting treatment. When our brain is in fight or flight, we become hyper-focused, and it takes a while for our brains to absorb what's going on. And you can't sustain that fight or flight for a long period of time. So once the reality sets in, patients can experience emotional distress and sadness surrounding this realization. But in the beginning, they just want to get it over with, get through it. What helps in a long-term situation is pacing oneself. The run fast really hard and get it over with only lasts so long. And so pacing yourself means taking it slowly and steadily, taking care of yourself, taking drinks of water and eating and doing things that you enjoy doing for the long haul. It's hard to say when you just want to cross the finish line, but you have to take it slow and steady. And then there's some patients who don't have a finish line. So there's some patients who are dealing with chronic cancer. Another issue. Our society's set up to believe that something can be fixed. And with chronic cancers, it's more like diabetes or heart disease, where it's a matter of management and not fixing. And so that takes a different kind of acceptance and readjustment.
Yeah. That's really helpful. I also loved the illustration you were giving about the storm prep and coming together. So we think about kind of navigating the whole process of cancer as really having this village behind you. And do you have any suggestions for how AYAs can work with their village, whether it's their medical team, their caregivers, or other friends and family, kind of all these people that come in and out during the trajectory?
Yes. So communication is key. So the provider, I would recommend building trust and communicating your needs with your provider. It's a relationship like any other relationship. So as soon as you know, I tell my patients, it's like being a reporter, but a reporter who has no opinions. You're there to tell the doctor, tell your nurse practitioner, this is what I'm feeling, this is how long it's lasting, but not trying to figure out what's causing it, really letting take care of it. And my really good tool for that. Also, make sure that your caregivers know your medical providers. And with COVID, it is a little tricky, but there's my chart, there's phones, there's allowing release of information so that your caregiver can really understand and help you understand as well.
Yeah.
As far as caregivers go, if you have a large support system, it sounds really good, but it can be overwhelming. So a lot of patients and families tell me, gosh, I'm tired of telling so many people how we're doing. It's not always exciting or fun to discuss. And so I tell people to delegate, find somebody who wants to help and let them help share the news, or find one of the apps like AYA Care or Caring Bridge, where you can disseminate the information in a secure way to all your loved ones, and they can provide updates and messages of hope right back. But it's on time, not their time.
Yeah.
Yeah.
That's a really good practical suggestion. I know this is a loaded question, and this could be episodes upon episodes in and of themselves, but what kind of initial or basic suggestions do you have for a newly diagnosed AYA on how to handle everything else going on in their lives outside of cancer, whether it's school, work, your family, your kids, all the other responsibilities that you typically have?
Yes, cancer does not happen in a vacuum. So you may have already had a stressful life, like you said, with kids or school or work, and then you throw cancer on top of it, and it's really, really daunting. So again, it goes back to being open to help. Sometimes people get paralyzed and they're not used to reaching out for help, so it can be really difficult, but that's what we're there for. We can help you talk to your child or to your sibling about what are good things to educate children on their level as to what is cancer to make it less scary. We can help you with what to tell your employer, or how to talk to the school, or the fact that federal loans can be delayed. The payment can be delayed for 6 months till after treatment. Things that you may not know without doing a lot of homework.
Right.
So being open to that support can help in all of those fronts.
Yeah. And I think that's helpful too, to realize that you don't have to be the one person to take care of all of that. That there are people who's like you, that your whole job is devoted to helping people navigate all of this. And so realizing that you don't have to be the expert in all of those areas. And you can.
Yes. And my favorite thing that a patient ever said to me was that you are the thing I didn't even know I needed. So how would you know you had cancer?
Right.
Yeah.
No, that's so true. I love that. COVID, man, has sure changed things for everybody. But let's talk a little bit about COVID and AYAs and someone who's newly diagnosed. Do you have any advice for AYAs that kind of specific to this new normal that we're living?
Yes, this has been an especially difficult time for cancer patients with COVID. So we always preach, bring a support person to the clinic or to the hospital with you so you can have a second set of ears. So not having a second set of ears right now due to restrictions at times can be really challenging. So we're having to find other ways, like record what the doctor has said, or allowing their loved one to use my chart, things like that. But emotionally, it's been really hard. It's nice to have a support person there with you. So that's been tough. So again, I think it's just about that readjusting and recalibrating and managing your risks, of course, but finding alternate ways to do things that you love. A lot of people coped by going out or hanging out with their friends, and they can't do that anymore. So how can you hang out with your friends in a safe way? Keeping routines. Exercising is huge. I always tell patients to make their bed first thing in the morning. If you make your bed first thing in the morning, you've accomplished something, and that's a good feeling already. And then the Wellness House, Gilda's Club, Living Well, the Cancer Wellness Center, all have free, amazing classes. If you want to learn a new hobby, you can sign on to Hearts Need Art and you can learn how to play the ukulele. This is a great time to do something new. It works your brain And then it helps distract from what's going on with the cancer as well.
Those are great suggestions. In all of your infinite wisdom, is there anything else that you would, want to make sure that a newly diagnosed AYA or their family members know?
Yeah, it's tough to see in the beginning and even during the whole process, but cancer can actually bring about gifts. We don't talk about that enough, but I have seen people evolve and change. I've seen people who had not so healthy lifestyles prior to cancer who changed their lives for the better. I've seen families get closer. People learn new skills. So believe it or not, it's difficult, but there are gifts that can come from it.
Yeah. I know there's been a lot of really interesting research that has come out to that point, and kind of the technical term would be post-traumatic growth, and that through these traumatic and difficult experiences can come so much good and so much growth. And so I love that you point that out. Yeah. This has been such a helpful conversation, Jennifer, and I think just really underscores the value of people like you. And I know not everyone has access to an AYA Clinical Navigator, but I think you've done a lot to show us of just reaching out, and whether it's another social worker there at your hospital or anyone else that lives and breathes this world of cancer care every day can be so helpful to just welcome in and have them join your team. So thank you so much for taking time to talk with us about AYAs and how some suggestions for how to navigate a new diagnosis.
Thank you, Bryn.
Thank you so much for joining us today on The Scoop. We hope you enjoyed our conversation and learned something new. If you want to hear more of these in the future, make sure you like our page at Lurie AYA. We hope you have a happy day.